This is the first emergency meeting the minister is holding with all health commissioners under one roof to find solution to the Lassa fever outbreak. Minister of Health says more primary health care facilities will be activated to curtail further spread. He also attributes the rapid spread of the virus to a failed surveillance system and denial of the true health status in some states.
With a workshop last week, that in the next 3 months, we will at least activate 109 primary care facilities. The plan is that in this year alone, we should have 5,000 in place, and next year another 5,000. So if we have one per political ward, we will be able to trigger off a surveillance system that can feed into a national public health observatory, which will now work all the year round. Because what we have is a failure of the surveillance system. That someone died, we didn't report it, not another one, and we all assume death should be something to gloss over.
Health commissioners from affected states, however, insist they have active surveillance systems.
There's contact tracing currently being done by staff of the Irua Specialist Teaching Hospital, WHO profilers working with us in the state, and the disease surveillance notification officers at the state and local government areas. We are also actively following up on rumors and investigating alerts that come to us.
We have a very active surveillance system, and based on our data, we have about 128 suspected cases. Suspected because we have not confirmed from the laboratory, and for the sample we have seen, only 4 turned out to be positive.
Commissioners from unaffected states also highlight their preparedness.
We already have a designated center. Our governor is a seasoned microbiologist, so he understands what we are talking about. So we've designated a center for Lassa fever already in the states, of which we have a rapid response team that meets regularly, and we are doing everything possible to make sure that Lassa fever doesn't come to the state.
Although the disease has only been reported in 17 states, the minister says all the states need to be on red alert and think of preventing further outbreaks.
Even the rats that made it into 2016 causing us pain. We're looking at some of those issues and seeing how the year 2016 battling with an outbreak of the dreaded and deadly Lassa fever happened. But we're not being joined by 2 medical experts, medical professionals. Dr. Yahya Disu, he's a member of the Association of the Public Health Physicians of Nigeria. Good to have you join us. And of course, Dr. Lanre Aroguntade, Lanre Aroguntade, who is a medical expert as well. Good to have you join us on the program this evening. Dr. Disu, I also recall how we battled with, but though not in 2016, the era of the Ebola, and how Nigerians, you were in that team of Nigerians who helped the other African nation in Liberia. You were in Liberia just after we had that successful moment here in Lagos. But if you look at what is happening around the country with this very unfortunate outbreak again just before the close of 2016 in Ogun State, of what seemed to be another case of Lassa fever. How would you say we have fared in terms of curtailing all of this and put this side by side with our hygienic, culture in the year 2016?
I am happy that you mentioned the question of Ebola in 2014. Of course, we learned a lot of lessons from that. And then, first and foremost, when the Ebola came, it was a strange disease to us, but the existing institutions that we had, we were able to mobilize a response and then to curtail the outbreak. And the lessons learned from that, like surveillance, and then the epidemiology, that is contact tracing, and these are strong lessons we learned. And the issue of community mobilization, that is creating awareness about this disease, the signs and symptoms. And then those are things that were used to contain the Ebola then. Then Lassa fever and Ebola virus disease are similar because they are viral hemorrhagic fever. So they present with similar symptoms, only that Ebola is more deadly than Lassa fever. So we're able to manage this. But I think we have several number of outbreaks in 2016 because our surveillance system is very, very effective now. Yes, that is why we are getting those cases. They are reporting them. But the only challenge we had is the response, because ability to mobilize response, probably because it required logistics, it requires some expertise. Most of the places where you had this outbreak were not places where they had experience with Ebola. And then supplies were also needed. And then thinking that was the challenge that we had. Then in terms of infection prevention and control, which all healthcare workers must observe. And we also learned that in Ebola, but I think it's not yet part of our culture. That is exactly, you will see what happened, what played out in Ogun State recently. And then the mortuary guy who attended to the corpse, probably if he had observed IPC, that is infection prevention and control, maybe he wouldn't have been affected. So that is, but there are other things outside this that generally dictate what happens in the health sector, like issue of governance, issue of human resource, issue of healthcare financing, then issue of even service delivery. Because if you look at the pattern of our service delivery, we do more of curative. If you look at our budget spending on health, we spend more on curative than preventive. And what we really need is preventive approach in order to prevent those diseases, which is more cost effective.
Let's bring in Mr. Larry Arungutadi. He's not
thanks for the correction.
Yes, he's a doctor. He's the director of International Center. But you are very aware of the health issues with regards, talking about climate change now, and talking about the environment, Ogoni land cleanup. That was much celebrated when when the presidency went ahead and launched the cleanup, and the Honorable Minister for Environment took her team to Ogoni land, and we started talking about cleaning a land that had been laid almost desolate for so long. Talk to us about how that shaped 2016 for you, and put it, in perspective of talking about climate change as well.
Well, I mean, it's the cleanup of Ogoni definitely shaped 2016 because it's also, brought back, memories of people like, Ken Saro-Wiwa, who basically made the point that something was wrong with that environment that had been polluted, fought the oil companies, the multinationals, and invariably got hanged along with others. So in a sense, we had justice for people like Ken Saro-Wiwa. But beyond the issue of justice was the fact that the cleanup was long overdue, and it was a welcome development. Now the worrisome part of it now is that we're having more pollution in the Niger Delta or in the South region due to the activities of various militias that are bombing pipelines. So which means that in a few years' time you will be talking about cleaning up this environment again. So there are big challenges in this area. But the cleanup is also important because environment is very, very closely linked to the issue of healthcare delivery. And I'm happy that doctor here, medical doctor here, talked about the issue of Lassa fever. And if we look at it from that point of view, I think in the area of environment we're not doing enough to prevent diseases. It's not just about pollution of the environment. You have a lot of erosion. You have lack of provision of water. Almost every household now sink their borehole, not realizing that all these borehole, rodents, rats, they dig deep, they get into them. As a matter of fact, we're not too far away from earthquake. A single borehole, well managed, could serve entire communities, but every household, is sinking, a borehole. So, this is a problem. But I think that where we should be looking at, where we should really be talking to government now, is to remind the government that in 2001, African head of states met in Nigeria, in Abuja, and gave a commitment. It was a declaration that 15% of their budgets will go into the healthcare. Yes, there will be the question of where do you spend this money on, but I think this is where something has been missing, because up to now, up to the 2017 budget, we've not met this target of at least 15%, and I think it's very, very important.
Okay, so let's ask Dr. Disu if he thinks that can be achieved. Can we meet 50%, 15%?
Yes, we can, because even countries like Botswana, Rwanda, they've even achieved 17%. They've surpassed that 15%. And then there are about 5 countries in Africa that have surpassed that target. So it is very possible.
And you think it's
we
possible
have
to
the
be achieved
largest
in 2017?
GDP in Africa. And based on that, even if we go by proportion of our GDP that should go to health, we can achieve it. And then National Health Act was signed into law in 2014, and then they said that 1% of the consolidated revenue should go into funding for the primary health care and the National Health Insurance scheme. And then with that, by the time we pull all this together, we will to achieve it. But let me tell you, the major spending in healthcare comes from out of pocket. And surveys have shown that close to 70% of spending, total health spending, is out of pocket. And that is disastrous for the nation.
We're hoping that that's what the government will avoid when they get into 2017. Gentlemen, it's been a pleasure having you spend the evening with us here looking at 2016. Dr. Yahya Disu, Member, Association of Public Health Physicians of Nigeria, and Larry Arogundade, he's the Director of International Press Center. Yeah. And that's where we'll wrap this one, and we'll come back because we have quite a number yet untouched for the year 2016.
Stay with us.